You are welcome to my channel. Today I'll be going through the full list of clotting factors and talk briefly about the relationship between liver and clotting factors after. Factor 1 is fibrinogen. Factor 2 is prothrombin. Factor 3 is tissue factor or thromboplastin. Factor 4 is calcium ion. Factor 5 is liver factor or proaccelerating or accelerator globulin. There is no factor 6, but we have factor 7, that is stable factor or proconvertin. Factor 8 is anti-hemophilic factor A or anti-hemophilic globulin. Factor 9 is anti-hemophilic factor B or Christmas factor or plasma thromboplastin component. Factor 10 is power factor. Factor 11 is hemophilia C or Rosenthal syndrome or plasma thromboplastin antecedent. Factor 12 is Edgeman factor. 13 is fibrin stabilizing factor or Lauren factor. Other factors will include prekallikrein or Fletcher factor, high molecular weight kininogen or Fitzgerald or William factor, von Willebrand factor, platelets or vitamin K. Now, pathways to coagulation. The extrinsic pathway will make use of factors 5, 7, and 10. And when you want to know what is happening with that, you can have your PT done. And PT is also useful to monitor coumadin therapy. The intrinsic pathway will make use of factor 8, 9, and 11. And you can assay that using your APTT. APTT is also useful in monitoring heparin therapy. And a common pathway will make use of factors 1, 2, 5, 10, and 13, and the coagulation will be completed with the common pathway. Now, vitamin K dependent clotting factors. These will include factors 2, 7, 9, and 10. Liver and clotting factors. All clotting factors are produced in the liver hepatocytes, except 2. And those 2 that will not be produced in the liver hepatocytes will be factor 8 and von Willebrand factor. However, in liver disease, factor 8 will be raised, unlike the rest clotting factors that will be down. So with that, I've come to the end of this short presentation. This will be very, very useful when we start talking about bleeding and bleeding decrease. Thanks for listening. Remember to subscribe to my channel so that I can get all my presentations immediately they are published. There are more than 600 presentations right here. Please check my channel for whatever you need medically, and you can suggest any topic that you want me to cover. I appreciate it.